Withdrawal syndrome, or having a physical withdrawal, is not a universal characteristic of addictions, because there are a lot of addictions that don't cause a physical withdrawal. Gambling and sex and other behaviours, for example, obviously you're not putting a chemical into your body, therefore you cannot possibly have a literal physical withdrawal when you stop using them or doing them. And indeed there are also substances that you can use that won't cause a physical withdrawal, including most stimulants like cocaine. You will of course have a very profound, potentially very profound psychological withdrawal with some physical feelings, but your nervous system won't go into overdrive as it would with benzodiazepines, alcohol and opioids. So cravings is a much more universal feature of addictions than physical withdrawal. And cravings are predominantly, entirely psychological. So I put here ER, which stands for euphoric recall. That's one of the things that addicted people tend to do. It's a bit like daydreaming and allowing your mind to wander into what it was like when you used to use or act out your addiction. And that's quite dangerous because it stimulates cravings. I put here PPT, stands for people, places and things. These are the things which trigger cravings and then make us want to return to our drug or behaviour, addictive drug or behaviour of choice. Another thing that characterises addicts as opposed to people who aren't addicted, and this might take place before, during and after their actual drug use, is that they seem to display dysfunctional emotional states. Primary among those would be anger, fear, funnily boredom, which is kind of related, I think, to the dopamine dysfunction that we discussed in the last video. There's this curious symptom that addicted people seem to have, which is separate to other disorders, behavioural disorders or illnesses, which is that they get this kind of mind-numbing boredom. It's a bit which then leads to cravings, which then leads to them acting out their addiction. And of course, guilt. There's a lot of talk these days about guilt and shame and how they're different. Maybe, but guilt is an emotion that's to be expected when you've been living an addicted life, because you've almost certainly done things